If you can find more P waves than QRS complexes in an ECG, then that's a clear sign that something is wrong with atrioventricular or AV conduction. More precisely, that tells you that you're probably dealing with high-degree AV block. What is high-degree AV block? That is either second or third-degree AV block. In this module, you're going to learn what these types of blocks are and how to differentiate them on the ECG. Let's start off with third-degree AV block, or complete AV block as it's also called.
We come back to the situation we have already seen in the last module, where conduction from the atria to the ventricles was completely blocked. But before we go on, we zoom into the AV conduction structures and we see that they consist of the AV node, the bundle of His, and the proximal parts of the intraventricular fascicles. Each of these three can be involved, but usually the problem is located within the AV node itself. When there is a complete block of the AV conduction structures, the atria and the ventricles are beating completely independently of one another. What types of rhythms can be found in the atria? Let's have a look. Here are a couple of examples of rhythms that could be found in the atria during a complete AV block. You could find sinus rhythm, a junctional rhythm, atrial flutter, or atrial fibrillation. Some people might have an ectopic atrial focus or atrial tachycardia. There are a lot of possible rhythms that could be present in the atria, but these are probably the most common ones. Let's check out a real case of a third-degree AV block with non-conducted sinus activity in the atria. This is an example you have already seen in a previous lesson. There's sinus activity going on in the atria, and this sinus activity is not conducted down into the ventricles. That's what the ECG would actually look like if there was no ventricular focus taking over. And that's what the patient would look like. Fortunately, for this patient, there's a ventricular focus that takes over the pacemaker function in a complete AV block. As you can see, this ventricular focus beats at a much slower rate than the sinus node up here. Very often that new focus is located somewhere in the conduction system, but it can also be located outside. Let's see what happens in the ladder diagram. The ventricular focus takes over and produces ventricular beats at a rate of around 40 to 45 per minute. This is also called a third-degree AV block with a ventricular escape rhythm. Now let's get our hands dirty and see how we can reach a diagnosis in a different real-world example. The first thing that we see when we look at this example is that there is an excess of P waves. There are a lot more P waves than QRS complexes, and the QRS complexes themselves are fairly regular with an approximate heart rate of 40 to 45 per minute. Let's try to identify the different components of the ECG curve. Let's start with what is most simple in this example, the identification of QRS complexes. There's one here, one here, one here, one here, and one here. So 5 QRS complexes in total, but where are the P waves? There could be one here, one here, one here, here, one here. Not sure here. This could be one. This could be one. You know what? Let's use the trick that we've learned in the last video, the paper and pen method. So we take a piece of paper and we identify the shortest P to P interval we can find on the strip, which would be this one here. Now we're moving the paper over here to the beginning of the strip. So marking this P wave, we know that we would actually expect the second P wave to be located around here. So this has to be a P wave. Let's move along the paper. So the next P wave must be located here. Next P wave here, 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 and here. All in all, we have 12 P waves and only 5 QRS complexes. Furthermore, when we try to measure the distance from P to the subsequent QRS complex, in other words, the PR interval, we see that these intervals are completely random and variable because the atria and the ventricles are beating completely independently of one another. So with that knowledge in mind, I want to sum up what we already know about third-degree AV block or complete AV block. First of all, in third-degree AV block, there is an excess of regular P waves with more P waves than QRS complexes. And the P waves appear at regular intervals. Secondly, the PI intervals are variable. And thirdly, the QRS complexes appear at regular intervals. There's one more thing that I would like you to know about the QRS morphology in third-degree AV block. The ventricular pacemaker focus that takes over can actually be located closely to the ventricular conduction structures or further away from them. If they're located close to the conduction structures, then the QRS complex will be narrow. And when they're located further away from the conduction structures, then the QRS complex will be broad.
Sometimes AV conduction is not completely interrupted. We'll investigate this further in the next lesson.
So I hope you liked this video. Absolutely make sure to check out the course this video was taken from and to register for a free trial account which will give you access to selected chapters of the course. If you want to learn how Med Mastery can help you become a great clinician, make sure to watch the About Med Mastery video. So thanks for watching, and I hope to see you again soon.